morning. I'm Desi Fleming, Director of Fargo Cass Public Health, and welcome to this August 31st health briefing on COVID-19. I would love to say this is a repeat broadcast from 2020, but the reality is it's a year later and we are seeing again a changing pandemic environment. Given the urgency of our current situation, we felt it necessary to update the community as we enter our fourth wave with the Delta variant changing the game. This morning we have with us representatives from Fargo Cass Public Health, the North Dakota Department of Health, Clay County Public Health of Minnesota, along with Essentia and Sanford Health Systems. I thank you all for being here and for the expertise you bring. For many of us, the past 18 months have been a roller coaster of emotions, many times bordering on exhaustion. Many in our community, including myself, were eagerly awaiting the arrival of a vaccine. And not only did we get a vaccine in less than a year that went through all of the required safety protocols, we got a very effective vaccine that helps prevent serious illness and death. Unfortunately, even with data to support vaccine safety and effectiveness, along with medical experts advising, we continue to have vaccine rates below the national average in our state. If you look to the news, you can read about the devastation Delta is causing across the nation. And what is concerning, Delta is impacting different sections of the population than in previous surges. We see ICUs and pediatric ICUs in the southern states at capacity and high numbers of serious health outcomes, many which could have been prevented with a simple vaccine. North Dakota has similar low immunization rates to those states, which is why we are here speaking to you today to hopefully avoid those same impacts in our area. The longer we allow this virus to circulate, the greater chance we will see future variants that may or may not respond to the current vaccine. That is a situation we do not want. The time to get vaccinated is now to protect yourself, your family, and our community. It is also important to know that vaccination takes 4 to 6 weeks for full effectiveness, so adding other layers of protection, such as masking in public and avoiding crowds, are necessary. Long-term, vaccination is the best tool we have to get through this pandemic and any future surges. The vaccine is free, and locations can be found at vaccinefinder.org. COVID vaccine is currently available to those eligible that are 12 years and older, with full FDA approval for the Pfizer vaccine for those over the age of 16. We have a large population of children under 12 who, due to age, are not eligible for vaccination, along with some adults who have contraindications to receiving vaccine who are at risk for exposure. It is so important for all those that are eligible to be vaccinated to protect those who cannot. The COVID vaccines are proven to be safe and very effective, as researchers have been studying and working with mRNA vaccines for decades. This is not a new science. It is a new vaccine in a family of previously studied coronaviruses. CDC is recommending an additional dose for those individuals that are moderately to severely immunocompromised, such as organ transplant patients. We encourage residents with significant immune system issues to connect with their healthcare provider to discuss if an additional dose is indicated for you. CDC is also recommending a booster dose and will be sending out further information on priority groups once full approval is given. Booster doses may be needed for waning immunity for those fully vaccinated and are not yet available, but should be available around the end of September. Again, please see vaccinefinder.org for vaccination opportunities. Next speaking, we will hear from Dr. Tracy Newman. Dr. Newman is a local pediatrician and the health officer for Fargo Cass Public Health.
Thank you, Desi. Good morning. I was asked to speak this morning to give an update around the Delta variant and what we are seeing specifically in pediatrics. The SARS-CoV-2 Delta variant emerged in India, is currently widespread and the predominant variant in the United States, and evidence suggests it is much more transmissible than previous strains. Next slide, please. The Delta variant causes more infection and spreads faster than earlier forms of SARS-CoV-2. A person infected with Delta carries a much higher viral load and can spread the virus to an average of 8 other people. Next slide. This is more contagious than previous SARS strains and viruses that cause common colds, influenza, and even Ebola. The Delta variant is considered as contagious as chickenpox and more contagious than smallpox. This has created a new and pressing risk for children, particularly those under the age of 12, which, as Desi said, are not yet eligible for COVID-19 vaccination. Next slide, please. In recent weeks, children have made up a higher proportion of overall infections. These have been substantial weekly increases and are predicted to continue. Pediatric COVID-19 hospitalizations have reached record highs in the United States, with the CDC reporting over 50,660 admissions through the month of August thus far. The 7-day average calculated for last week, ending on August 23rd, was about 309 daily hospital admissions for Americans ages 0 to 17 with confirmed COVID-19. This marks a peak high. This is an 11.4% increase from the prior 7-day average. For the first time during the pandemic, pediatric hospitals are struggling to treat the number of young patients developing disease. We need only to look to states such as Louisiana, Florida, Tennessee, Alabama, and Texas to see this. While it is still believed that individual children have a low chance of developing severe disease, the current pediatric surge, which has been confounded by an unseasonal spike in things like RSV and parainfluenza cases, have serious implications for our healthcare facilities. The nation's children's hospitals are being pushed to capacity, and they have collectively called on leaders in the public and private sectors and the American public to help protect our children by getting vaccinated, masking responsibly, particularly during school and when attending large gatherings. Next slide, please. This is true across the U.S., throughout the state of North Dakota, and in Cass and Clay counties. Viral spread continues to be predominantly among unvaccinated people, a large percentage of which are children under the age of 12. So here I have new cases for the state of North Dakota for pediatrics. This is as of last Friday, August 27th. As you can see, in one day, we had 61 new cases of COVID-19 in children. And I just wanted to highlight the levels in the younger ages: 23 new cases in 0 to 5, 18 new cases in 6 to 11. We also have it by county, and there were 10 new cases in Cass County. The 61 new childhood cases account for 21% of the total new cases in all ages being reported. So these are much higher percentages than we've previously seen in the pandemic. Next slide. When we look at active pediatric cases, this is as of yesterday, we have 445 active cases in children. This is up from 307 just 1 week ago. And again, you can note the high numbers in younger ages: 130 in the 0 to 5-year-olds, 141 in 6 to 10-year-olds. These are all children who cannot receive vaccination yet. The 445 active cases account for 21.4% of our over 2,000 active cases in the state. And we currently have 3 North Dakota children hospitalized. We can look at the 7-day childhood COVID-19 cases by county. There are 440 total, and I just wanted to highlight there's 81 currently in Cass. Another metric used is a 7-day average of childhood cases per 100,000 population in counties. Our average for the entire state is 31.3. A Harvard metric considers any general population rate of 25 per 100,000 is out of control spread, and you can see the various county levels there. Next slide, please. In addition to rising cases in children, only 27.9% of vaccine-eligible adolescents in North Dakota have received partial vaccination, and only 22.1% are fully vaccinated. In Cass County, we have 46% of adolescents aged 12 to 18 who've received 1 dose, and 41.7% are up to date. North Dakota as a whole has only 51.4% of the population partially vaccinated and 47.5% fully vaccinated. Next slide. Increases in pediatric infections and hospitalizations are concerning medical, public health, and educational professionals as we look to bring children back into school buildings. This has prompted professional medical groups and the CDC to release updated guidance for community as well as schools. This guidance stresses the importance of getting vaccinated, as this is the #1 tool to prevent severe illness, hospitalization, and death. Next slide. It also helps reduce the spread of virus within communities. In an effort to have children return to in-person learning and keep them in school, the CDC recommends layered prevention and mitigation strategies, including universal face coverings for all teachers, staff, students, and visitors to K-12 schools, regardless of vaccination status. Schools must continue to take a multi-pronged approach in addition to vaccination and mask use, including all the things listed here. Next slide, please. In a CDC Morbidity and Mortality Weekly Report released this past Friday, a Delta variant outbreak in a California elementary school was described. This involved 26 lab-confirmed COVID-19 cases among elementary students and their contacts following exposure to an unvaccinated infected teacher. This teacher worked for 2 days before receiving a positive test, mostly masked. She would occasionally remove her mask to read aloud to her class. And shortly after, additional cases of COVID-19 were reported among staff members, students, parents, and siblings connected to the school. 22 of the teacher's 24 students, all eligible for vaccination, were tested, and 12 were positive, indicating an overall classroom attack rate of 50%. Risk was correlated with seating proximity to the teacher, as the attack rate in the 2 rows closest to her desk were 80% and 21% in the back 3 rows. Subsequently, 6 other students in a separate grade tested positive for COVID, and 8 additional cases were identified in parents and siblings, including 3 fully vaccinated individuals. This exemplifies the need for a layered approach to mitigation within schools, particularly highlighting the importance of vaccination and masking. Next slide. As we brace for the next wave of this pandemic and the expected Delta variant surge in North Dakota, it is vital that we are proactive as a community. We have an opportunity to act now, to do our best to prevent strain to our healthcare systems, to keep children in school where we know they learn and thrive best, and to protect one another. Children under the age of 12 are not yet eligible for vaccination and are largely at the mercy of the adults in their community. Thank you.
Thank you, Dr. Newman. We will now hear from Brenton Niesemeyer. Brenton is an epidemiologist and director of field services for the North Dakota Department of Health.
Thank you, Desi, and it's my honor to be here today, so thank you for inviting me. Next slide, please. This is just my agenda that I'll be going over today. So I will be talking about active cases, the positivity rate in both North Dakota and the Cass County, some breakthrough case data, and along with that, some of our death data. Next slide, please. So I would like to begin today by just sharing a little bit of a brief overview of the current state of COVID-19 in North Dakota. As of yesterday, North Dakota was at 2,084 active positive cases. So this is the number of active cases, the largest since the end of our previous peak in January. The positivity rate has also increased, which is the highest since the tail end of our fall 2020 peak statewide. You can see our positivity rate was about 6.4%, and we haven't been that high since that 2020 peak. Next slide. Cass County, as you can see, had 4 distinct peaks throughout the year, and currently we are at 367 active positive cases, the largest since the end of our March-April peak. The March-April peak was driven largely by the Alpha variant, and then this peak is driven largely by the Delta variant. The positivity rate is also similar to our March-April peak at about 5.4%. Next slide. Active infections, comparing this year to last year, if you look at the green line, that is our 2020, and then the red line is 2021 year to date. You can see that there's a steep slope that is comparable to that of last fall. So our numbers are increasing, our active infections are increasing, very similar to what we saw last fall. Next slide. Our new cases are our 14-day average. Individual days can have wide variance in positivity due to fluctuations in the number of people tested, especially over weekends or holidays. So that is why we often use a rolling average to better view this change over time. Our current 14-day rolling case average is about 255 cases per day, the highest it's been since it's reached mid-January. And these numbers are all statewide. Next slide. Our daily tests, while our cases are fairly similar to those of last year, we are still seeing significantly less testing. Our testing has started to increase. This is probably due to more symptomatic people being tested. Our hospital systems are seeing higher positivity in those being tested there. So many times people are being tested when they are already ill to the point where they need to seek medical attention. With less testing, there's higher possibility of more cases going undetected. And then this also plays into positivity. So less testing, more positives, you may get a higher positivity, but we also know there's undetected cases in the community. So it's hard to distinguish, and we do encourage testing as a means to help mitigate the spread. Next slide. Active hospitalizations. Hospitalizations are a lagging indicator, so we anticipate our hospitalizations will increase as time goes on. But you can see yesterday we did have a fairly significant increase, an increase of about 40 hospitalizations from the previous day. This is due to a lag of reporting over the weekend, but our hospitalizations have now surpassed this time last year, and we are seeing a greater number of people who require hospitalization due to COVID. Many times this is a younger population, and most of our hospitalizations continue to be those in our unvaccinated population. Next slide. Talking about unvaccinated and vaccinated data, and that is what we determine a breakthrough infection. So a breakthrough case is one that goes on to develop COVID disease who's already been vaccinated, or what we consider a breakthrough case. This dashboard is now available on the North Dakota Department of Health COVID dashboard. And then just to highlight on this dashboard before I go into more specifics, since COVID-19 vaccines were available on December 14th, 1 in 181 fully vaccinated people have tested positive for COVID-19, compared to 1 in 16 unvaccinated persons. Next slide. The average age of a breakthrough case, for those who are breakthrough, you can see the age difference. So the average age of a breakthrough case is 53, and the average age of a breakthrough not fully vaccinated case is 36. Next slide. Hospitalizations per 100,000 individuals. You can see that those who are not fully vaccinated, the numbers are significantly higher than those who are fully vaccinated. And then this is just broken down by age, and you can see the largest difference still amongst our older population, but still a difference, a very significant difference amongst all of our populations when comparing fully vaccinated to not fully vaccinated. Next slide. Our cases per 100,000 individuals, we still have a significant difference here. If we look at the difference, we have 259 cases per 100,000 of not fully vaccinated, compared to that of 22 cases amongst our fully vaccinated population. Next slide. Total hospitalizations, same trend. We have a significant difference between our fully vaccinated and our not fully vaccinated population over time. Next slide. And this is just an infographic that the North Dakota Department of Health shared on social media channels on August 25th. So our numbers have increased since then. 51 out of the 53 people hospitalized with COVID-19 in North Dakota were not fully vaccinated against COVID-19. So that means that only 2 individuals who were hospitalized on August 25th were fully vaccinated for COVID-19. Next slide. Comparing the hospitalization age amongst our fully vaccinated and our breakthrough cases, or fully vaccinated and not vaccinated cases, you can see that significant difference in age there, from 73 for our breakthrough cases to 59 for our not fully vaccinated population. Next slide. Now I'm going to move on to talk a little bit about our death data. As you can see, this is our deaths over time. Our peak of deaths did occur in November of 2020. We did have a fairly abrupt peak, and then it tailed off. And then we were, averaging since February, since more people have become fully vaccinated, right around that 10 to 20, 30 deaths per month. Our August numbers, year to date or August to date, are slightly going to be higher than they were in our previous week or previous months with 18. But we do anticipate our deaths to be lower due to a larger proportion of our older population being vaccinated. But that also means that we anticipate more of a difference in that age of our deaths between the two groups. Next slide. This is our deaths per 100,000 individuals. As you can see, the percentage of our vaccinated deaths is 0.00629%, and we've had 20 total breakthrough deaths since we started tracking our breakthrough data. Next slide. The average age amongst our breakthrough cases, our deaths, and are not fully vaccinated, there is a difference in that age. Our breakthrough deaths tend to be older versus our not fully vaccinated people who succumb to COVID-19. Next slide. And then I'd just like to thank two of my counterparts at the North Dakota Department of Health, Benjamin Schramm and Jennifer Galbraith, for their help with compiling this data and reviewing the slides and putting these slides together. And then next slide. I'd like to close and hoping that this information gives you an understanding of the difference between being vaccinated and not being vaccinated. Not only is vaccination the best means out of this, it also greatly reduces the hospitalizations and deaths and serious outcomes due to COVID-19 illness. And thank you everyone for listening to me today, and thank you, Desi.
Thank you, Brenton. We will now hear from Kathy McKay. Kathy is the administrator of Clay County Public Health, and she is joining us by phone today.
Good morning. I'll start with talking about our vaccine clinics that we're offering through public health in Clay County. We have some by appointment in our Family Service Center building on a weekly basis. We're also targeting some clinics to those in group settings, which we really want to reach, and that is the K-12 schools for youth ages 12 and up. We're doing clinics at the higher ed campuses in Moorhead, at our homeless shelters, our Clay County Correctional Facility, and also our West Central Regional Juvenile Detention Center. So some of the areas with higher risks for spread. We are also, we have information on our website for those that want to register. We're taking appointments for our clinics in the Family Service Center building, trying to avoid the wasting of any extra doses that we may have. The saliva testing site in Moorhead continues to provide the testing for both Minnesota and North Dakota residents. We are in hopes that this saliva testing site will continue through the end of this year, and we're not sure beyond that. But the testing information of dates and days of the week and times that they are available is also listed on our Clay County website. During this time, we need to be vigilant with our behavioral and pharmacological methods of how we're working with the COVID vaccine. Excuse me. Clay County and Cass County are currently in a high-risk community transmission level, and that's based on CDC indicators. We know that the Delta variant is causing more infections and spreading faster than our earlier forms of the virus. So COVID continues to present many challenges, as others have talked about, and continues to have a tremendous toll on our nation. We know infections can happen, and the evidence suggests that fully vaccinated people can become infected with this new Delta variant and spread the virus to others. So at this time, while we build the level of vaccinations nationwide, we must use our prevention strategies to stop the transmission in this pandemic. This includes vaccinations, masking, and social distancing. The COVID vaccines are safe and effective at preventing COVID, including reducing severe illness and death with the Delta variant. Infections happen only in a small proportion of people who are fully vaccinated, even with the Delta variant, and they tend to be mild. If you're fully vaccinated and become infected, you can spread the virus to others, however. People with weakened immune systems may not be fully protected, even if they're fully vaccinated. The CDC masking guidance includes masking for all people in indoor places. That is even the people that are vaccinated, because this Delta variant is much more infectious than the original. So that is the recommendation, and particularly because both counties are in the high community transmission level. Those people with weakened immune system, or because of age or underlying medical conditions, which puts you at an increased risk for severe disease, could choose to wear a mask regardless of the level of community transmission. Masking in outdoor settings is not necessarily needed if the numbers of COVID cases in your areas are not at a high level. However, if you're in crowded outdoor settings, especially with those that are unvaccinated, the recommendations for masking is there. There's a lot of misinformation that continues to circulate about the COVID vaccine, and I'll just mention a few of those. The COVID vaccine does not alter your DNA. The material never enters the nucleus of the cell, which is where our DNA is kept. COVID vaccine does not contain microchips. It doesn't cause you to be magnetic. The vaccine is developed to fight the disease, and it does not contain any metal. And there is currently no evidence that the vaccine causes problems with pregnancy. In addition, there's no evidence that male or female fertility problems are a side effect with the COVID vaccine or any other vaccines. So to find credible information, we're often asked, where is the credible information? Because there's so much misinformation that is out there. So the CDC, which is the Center for Disease Control, is a credible source. The content is researched. It's written by subject matter experts, which include physicians, researchers, epidemiologists, and analysts. The content is also based on peer-reviewed science. So that is a very credible source to get information on everything in regards to the COVID vaccine and the COVID disease. Other sources of credible information include our state health departments, North Dakota Department of Health, Minnesota Department of Health, and others, our local public health agencies, and our local healthcare systems, including the medical providers there. So if you really are looking for credible sources of information and want the accurate information, those are sources that you should really look for in getting the correct information. And that's all I have. Thank you, Desi.
Thank you, Kathy. Next, we will hear from Becky Schmidt. Becky is also with Clay County Public Health and joining us by phone as well.
Thank you, Desi. Good morning. We have seen a substantial rise in COVID cases in Clay County over the past several weeks. Throughout most of June and July, we were seeing on average a handful of cases per week. We are now seeing over 100 cases reported in a given week. These numbers are at the highest level since our last spike in April of this year. Also of note, our cases are more than 4 times higher now than they were at the same time a year ago. The majority of newly reported cases are in the age groups with the lowest vaccine uptake, including those that are too young to be eligible to receive the vaccine. We are seeing many more infections in young children and adolescents than ever before. 90% of Clay County residents over the age of 65 are fully vaccinated and make up the minority of newly reported cases. We are also beginning to see an increase in the number of Clay County cases needing hospitalization, which is typical following an uptick in reported cases, and is why hospitalizations are often described as being a lagging indicator of resurgence. In the previous week, we had 10 Clay County residents admitted to the hospital. In comparison to earlier this summer, we had on average 1 to 2 admissions per week. The average age of those in the hospital due to COVID throughout August was 54 years, with a range of 24 to 84 years. We are seeing the same trends throughout the state of Minnesota as a whole. Delta is now the dominant variant circulating statewide, representing more than 95% of all sequenced samples. In July, the percent positivity rate was at 2%. It is now over the caution threshold at 6%. Statewide, cases are at levels not seen since April. Just as we are seeing at the local level, the Delta spike has brought with it a change in the number of cases seen in children. During the fall 2020 surge, children under the age of 10 accounted for 5% of total reported cases. That percentage has doubled over the past couple of months. Hospitalizations have surpassed 500 admissions per week throughout the state, with over 100 of those being admitted to the ICU. This is a substantial rise from earlier this summer. While children are still much less likely to require hospitalization than older individuals, we are unfortunately starting to see a rise in the number of young children and adolescents requiring hospitalization. As other infectious disease experts have stated, this has become a pandemic of the unvaccinated, as the vast majority of those that are hospitalized and dying are not vaccinated. Statewide, we have very good vaccine uptake in those over 65, with well over 700,000 people who have completed the vaccine series, which is over 90% of that age group. We are seeing close to the same rate for those 65 plus in Clay County as well. In comparison, when we look at the total population in the state, including those that are too young to receive the vaccine, we only have 55% that have been fully vaccinated. The Minnesota Department of Health is monitoring for any breakthrough infections in fully vaccinated individuals. Of the 3 million Minnesotans who are fully vaccinated, we have seen 0.4% become infected and 0.027% be hospitalized, with 0.002% dying. These numbers underscore the effectiveness of the vaccine at preventing against severe illness and death. If you have not been vaccinated or you have a loved one that has not been, please reach out to a trusted medical provider or your local public health department to discuss your concerns and address any questions that you may have. Thank you.
Thank you, Becky. Next up is Dr. Rich Vetter. Dr. Vetter is the Chief Medical Officer for Essential Health in Fargo.
Great. Good morning, everyone, and thank you for this opportunity to provide an update from Essential Health on our ongoing efforts to respond to this COVID pandemic and our efforts to keep our patients, staff, and communities safe and healthy. I want to first begin by thanking and recognizing the heroic efforts of our nurses, our staff, our physicians, our providers. They've worked diligently over the last 18 months to provide the care that our patients have needed, and time again have stepped up to provide exceptional care. So thank you to all of them. I'm going to start with some overall volumes in our hospitals and clinics. We've been very busy over the past 3 to 4 months. This increase is due mostly to increasing medical needs of patients in the community, including many of those who probably had foregone a previous treatment during the previous surge. But over the past few weeks, we've also been seeing increased number of COVID patients as well. Back at the end of June, we averaged about just 1 to 2 inpatients that were COVID positive. And over the past couple of weeks, that's risen to about 7 to 8% of our population on our inpatient wards are now COVID positive. On a daily basis, our hospital's been at or near capacity. We've been working having regular contact with our other hospitals and health systems throughout the state of North Dakota and Minnesota to help coordinate bed capacity and resources. As of today in Fargo, we have 11 inpatients, 2 in the ICU and 1 on a ventilator that are COVID positive. Next, I would like to just kind of provide a quick summary or overview of some of the signs and symptoms of COVID-19 infection. You might have heard that the Delta virus presents with some different symptoms from the previous strains. Like the other strains, the standard symptoms of COVID infection, which predominantly are loss of taste and smell, cough, shortness of breath, fever, chills, sore throat, headache, body aches, are all very similar to the previous strains. We are seeing an increased number, though, of GI symptoms with the Delta strain, and sometimes even just GI symptoms alone without the respiratory component. And then, just like the other strains, people that are just asymptomatic as well. As was mentioned, the Delta virus is much more contagious and has a shorter incubation period. And so the time from being in contact with somebody who's positive and you catching it is a shorter time frame. Over the past 18 months, we've been working diligently to improve our testing efforts and our testing capacity. There's several ways that you can be tested. As was mentioned, public health is doing testing, but through Essential Health, you can go through your MyChart app and request a test that way. That's probably the easiest and quickest way. You can do an e-visit where you enter your symptoms, and if warranted, a test will be ordered for you. And then finally, you can do a face-to-face visit with any one of our primary care or urgent care clinics, and they have rapid testing available in those clinics with a turnaround time of less than an hour. And then finally, we continue to test all of our inpatients and surgical patients as well. So why is testing important? Well, testing is important for a couple of reasons. One is we want to make sure that we can confirm the diagnosis when you have symptoms that are consistent with a COVID infection. It's also important when you're in close contact with somebody who was COVID positive. This early testing and detection will help us to better isolate, implement the quarantine guidelines to reduce the spread to others in our community. The other benefit of early testing, it also opens up the avenue for monoclonal antibody therapy. The current predominant monoclonal antibody therapy right now is Regeneron, which we do know has shown to reduce the need for hospitalization and serious illness, and is a very effective way in treating people that meet criteria or that are high risk for COVID complications to receive a one-time infusion therapy to reduce their need for hospitalization and keep those hospital beds open for other patients who might need those services. At Essential Health, we also continue to review all of our positive COVID results that we do in-house, and we are reaching out proactively to those people that meet criteria and offering them the monoclonal antibody infusion therapy. Just a couple of comments about the COVID-19 vaccines. As has been mentioned, we have a plentiful supply of vaccines available right now. The vaccines are highly effective with very low risk. It was also mentioned in young women, which seems to be a big group that has concerns about this. Pregnancy actually increases your risk of preterm labor if you catch COVID, and also increases the risk of you becoming sicker with COVID when you're pregnant. As was also mentioned, there's no evidence of any effect or impact on fertility rates. Finally, we have been seeing some good news. We have seen vaccination rates increasing throughout our community. I think the state has reported that, as well as internally we're noticing that, which is great. So if you haven't been yet vaccinated, I would highly encourage you to do so. And again, as was mentioned, the majority of our hospitalizations and deaths are in that unvaccinated population. We began a couple of weeks ago using our EMR to identify those immune-compromised patients, to reach out to them if they were eligible for the third dose. And so you may have gotten a message that you were eligible. If you haven't been contacted and you have questions, we would ask that you contact or talk with your primary care provider about whether or not you fit the definition of an immune-compromised person and are eligible for that third dose. We are currently busy planning for when booster doses are approved by the CDC and the Advisory Committee on Immunization Practices. And we currently have vaccine available in our clinics as well as our urgent care departments that can be received in those locations. Finally, I just want to remind people not to forego any other chronic medical conditions or regular checkups with their primary care provider. One of the reasons we're seeing that increased numbers of people accessing our ERs, our clinics, our hospitals right now is because of some of that care that was foregone a year ago. And then a final comment on what can the community do to help us? There's a lot of anxiety out there right now, a lot of uncertainty, particularly in regards to COVID vaccination. I would encourage you, as I said, to consider being vaccinated and talking to your family and friends, doing the other mitigation strategies, but also doing it with some concern and some love and understanding, and giving people some grace as they make that decision. All of us start in a different place, and I think we have to meet people where they're at. And so just ask that people do it in a respectful and helpful and loving way. And then finally, you can support our healthcare workers by following the mitigation strategies that have been outlined, getting vaccinated, staying home if you're sick, and getting tested, and following the health department guidelines for quarantine. I have no doubt that together we can do this. Just ask for your support. Thank you.
Thank you, Dr. Vetter. Last up, we will hear from Dr. Doug Griffin. Dr. Griffin is Vice President and Medical Officer for Sanford Health in Fargo.
Good morning. Thanks for allowing me to participate today. I wanted to point out, first of all, a theme of our hospital and its busyness. Our hospital is incredibly busy. In the last few weeks, we have experienced a very high number of patients as the Delta variant continues to spread. The overall number of patients in our medical centers in Fargo continues to stay well above 500, and today we are just a few patients shy of our record census reached during the last COVID peak in November. 39 of these patients are being treated for COVID. 9 of those are in intensive care on ventilators. We have 2 pediatric inpatients. Across the Sanford footprint, 95% of our COVID inpatients are unvaccinated. While pediatric cases are rising nationally, as Dr. Newman pointed out, we have had just a few children hospitalized so far, but we are preparing to see more cases due to the Delta variant's impact on children. In addition, RSV cases are high, with 238 children testing positive this August compared to 0 last August, and also remarkably last January, no RSV cases at all. So, and our children's hospital is at maximum capacity as well. So Sanford Fargo has reactivated a higher stage in our pandemic surge plan. We are reassigning medical staff, clinical resources, and equipment based on our greatest need. Right now, we're continuing to perform non-emergent surgeries, but are anticipating in the near future we may need to reduce surgical time to redeploy staff. As the demands for our services continue to increase, our priority is ensuring patients receive the care they need. This includes caring for patients close to home and patients who need the elevated services such as our Level 1 Trauma Center and comprehensive stroke services and other subspecialties that aren't available elsewhere in the state or region. We are also doing everything we can to help other hospitals, especially when patients can receive the same level of care locally and prevent a transfer. In addition, we have strengthened our face mask requirements in all clinical and non-clinical facilities for visitors, patients, and employees. And we've always been masking in clinical settings, but now following the CDC guidance indoors, and all people, regardless of vaccination status, should be masked. And all Sanford employees and providers are required to be fully vaccinated for COVID and the flu by November 1st. Sanford Health has booster doses of the COVID-19 vaccine widely available, as vaccines are available for people doing the primary injection as well in our primary care clinics, our acute care clinics, and select specialty care clinics. This dose is available for moderately to severe immunocompromised people. Those who meet the requirements put out by the CDC are welcome to walk into one of our primary or acute care clinics or make an appointment. We have also notified eligible people via our MyChart notification as well. We have been seeing increasing testing volumes, and we are concerned about possibly some supply shortages, so we've been reintroducing the antigen testing for symptomatic patients in our clinics beginning this week. The monoclonal antibody infusion treatment for eligible COVID-19 patients is proving effective. We have shortened the infusion time to just 20 minutes so we can increase our turnaround. We have noted in our data that patients age 60 and over who have been treated with monoclonal antibodies have a hospitalization rate less than half of those that have not received the monoclonal antibodies. So we urge people to consider that and actively recruiting and informing patients when they're eligible for that. Even with all our efforts, the Delta variant is more contagious and cases continue to rise, as we have seen data provided today. It's up to each of us to take the responsibility and do our part to stop the spread. Please follow the CDC guidelines for wearing face masks, practicing good hand hygiene, and social distancing. As Dr. Vetter suggested, it's very important to get tested the earliest sign of symptoms. And please, please get the COVID-19 and flu vaccines as soon as possible. They are safe and effective and our best way out of this pandemic. In addition to providing vaccines at our clinics, we will host several free community vaccination blitzes at the Fargo Dome in September 19th, September 30th, and October 2nd. You can find more information on sanfordhealth.org. Sanford will continue to play a leadership role in keeping our communities safe. And finally, we are so incredibly grateful to our Sanford physicians, nurses, and other staff who continue to work very long hours and provide outstanding care to all our patients with kindness and compassion. Thank you very much for your time.
Thank you, Dr. Griffin. I too would like to thank all of the healthcare providers throughout the community and for all the work they've done. I would like to thank all of our speakers today for providing information and updates, and I appreciate the collaborative effort to help better guide our community through this evolving pandemic. In closing, let me leave you with a thought. This pandemic does not end when those of us on this briefing, or medical professionals, or elected officials, or the CDC says it does. Ultimately, this pandemic ends when society determines it. And that will be through vaccinations, wearing masks, and doing whatever is necessary to stop this virus from further spreading. Please, I urge you to do your part. Thank you again for joining us today. Have a great day.